Welcome everyone to my channel O Give, that is Obstetrics, Gynae, Infertility Views. Today I am going to speak the basic things about the urinary tract infection in women, because the urinary infection is very common in female than in male. And why that is? Because there are some anatomical causes for it. Along with this, there may be some predisposing causes. So, regarding the anatomy, why the urinary tract infection is common in female? Very basic things I can say is that the female urethra is comparatively short, and at the same time, uh, compared to the male, there is a more chances of having urinary tract infection when the bladder uh, is not emptied frequently, and with the other predisposing causes, the like the pregnancy, if she had the diabetes mellitus, or in other immunocompromised state, then in that case the chances of urinary tract infection is always much more in female compared to the male. Now, the woman gets very confused whenever she had the urinary tract infection, because the basic things a woman should know that she might have a urinary tract infection. The basic things is a very simple thing. So once she had this symptom, then she can easily at least doubt that she had urinary tract infection. Now, what are the symptoms? The woman will fail. She will have urgency of urination. There may be frequency of urination. There may be a burning sensation during urination. There may be a little bit of pain abdomen in the lower abdomen, and sometimes there is a feverish feeling, but the fever is always not much high in urinary infection in the initial stage. So once a woman have this symptom, then most of the women actually do not have the idea that she is having urinary infection. She thinks of the other things that she is having. She might have some problem of the uterus, ovaries, or like other causes. So once she knows what are the basic symptoms she might have, if she had a urinary infection, at least she'll feel less tense, or she'll have less anxiety, and she can do the simplest thing herself. She can go to the nearby doctor and take the advice. So once the woman have burning sensation in the urine, there is urgency of urine, there is frequency of urination with little bit of pain abdomen, then she should follow the following advices. Now, as I said earlier, there is some anatomical causes for which the urinary tract infection is much more common in female. Along with this, it is also very much common during pregnancy. If the woman has some other predisposing cause like diabetes mellitus, or she is immunocompromised with some diseases, then all this might lead to an increased frequency of urine infection. Okay, now, uh, so we can say now what are the things she need to know. And now once she had suspected that she had a urinary tract infection, then the basic thing she can do is that she can do first take a urine sample. The urine sample should be taken as far as possible early in the morning, and it should be a mid-stream sample. And with the sample, she can give it to a nearby lab for a routine urine examination, number one, number two, for a urine for culture and sensitivity test. These two tests is very important, which will easily rule out urinary tract infection, and that will help her in making a differential diagnosis, or she can approach a doctor with the report that she had this report. If the report is normal, it is okay. If the report is having something to that she is not being able to understand it, she can go to the nearby doctor. I can show it, so the diagnosis can be easily made, and that unnecessary pain or trauma of thinking of different diseases for having those symptoms can be minimized. Okay. Now, for the urine sample, actually, how to take the urine sample? We should not clean the area with any antiseptic solution before taking the urine sample. It should be ideally, nowadays wipes are available in the pharmacy, or with a sterile gauze. The area can be wiped, and as far as possible, a morning sample should be given. So, apart from this, once the report comes, if she had a urinary infection, so what are the common organism which is uh, which is very important and which are in fact very common in most of the urine culture and sensitivity report. The organism like the Escherichia coli, which we call E. coli, or Klebsiella, there may be Proteus mirabilis, there may be some anaerobic infection. So once a diagnosis is made of the urinary tract infection, then the appropriate treatment can be started immediately after the report comes. Usually, the urine culture report takes 2 days, so 72 hours to come. So, by that time, she can, if she is continuously having the symptom, if the symptoms are less, then it's okay. Otherwise, if she is having more symptoms till the report of the culture sensitivity comes, she can approach a nearby doctor and start one antibiotic along with some antispasmodic painkiller so that she get the relief till the report comes. And the blood test is not very much suggestive of urinary infection, but to rule out other infection, we can do the routine RE blood. That is okay. And if she had other predisposing causes like diabetes or any other disease, then the respective investigation should be done with the advice of a nearby doctor. Now, once the report comes, and if she has the woman approaches a nearby doctor, or nowadays online consultation is also available, she can take the advice of a doctor, and that specific antibiotic should be started. She should start the antibiotic immediately, and this antibiotic should be continued for at least 7 days. And if she had too much burning, she can take a alkalizer solution like the Alka-Sol. Nowadays, lots of brands are available in the market. Along with this, she had to take a plenty of water, that is fluid, so that the urine is flushed out very frequently. And once she started taking the antibiotic, and the antibiotic will take its action. And once she drinks too much of fluid, or if she voids very frequently, this will help her to flush out the bacteria. And another thing which has an added advantage along with this therapy, especially in the infection of like the Escherichia coli, is the nowadays is very common and it's readily available in market, is a cranberry extract. It's available in both tablet form and in syrup form. So, if the patient is diabetic, it may be difficult to take the syrup form. If she has high sugar, so she can take the tablet form. Now, along with the antibiotic, if she drinks plenty of fluid and takes the cranberry extract along with some vitamins, is not at all necessary in urinary infection. But the thing is that the idea is to take plenty of fluids to kill the bacteria inside as per the culture and sensitivity report and to flush it out. So this is very common, and it has been noted that urinary tract infection is very common during pregnancy and especially in the young girls. Why? Because in those girls who are school going girls used to like they used to sit in the class for a long time holding the urine and not avoiding the urine. So this is not a good habit which needs to be modified, and I want to spread the message that the school going girls the young woman or any elderly woman, the idea should be is not to hold the urine for too long, and it should be avoided as far as possible once she had the urge. Now, this is a very basic view I have given regarding the urinary tract infection, and why it is important, because urinary tract infection is not a big thing and it can be diagnosed easily with a little bit of consciousness, and if the patient is aware actually what is urinary tract infection, what is going to happen when she had urinary tract infection. At least she will be less tense when she had the symptom. She can approach a doctor, do these few tests, and it can be treated early. But the thing is that if the urinary tract infection is not treated and there is recurrent urinary tract infection, the growth of the bacteria may be more, and subsequently it might have an ascending type of infection where the infection may spread from the urinary bladder upwards towards the kidney, which in severe cases may lead to acute pyelonephritis, or what in simple language I can say involving the kidney areas with the ureters. And if these things happen, then she needs an aggressive treatment. Sometimes patient had to get admitted in hospital, even in ICU, if the urinary tract infection is taken very lightly, and especially during pregnancy, it is most commonly seen, but in any case, if it's a case of urinary tract infection, so it should be like the patient should be aware. The immediate steps should be taken to do the urine, at least the urine investigation, and to take the advice of a doctor, and to start the antibiotic as per advice of the doctor, and to drink plenty of fluid, to flush out the urine, and as far as possible, even after the correction of the urinary tract infection, if she had any predisposing cause like diabetes, etc., these things needs to be controlled, because there is always a chance of recurrent urinary tract infection, which in fact is very dangerous in the way that the organisms become resistant to the antibiotic. So the urinary tract infection should not be taken lightly, even she had a minimal symptom, and it should be treated adequately to the full extent, so that it doesn't recur and the woman can live a life out of the fear for having a recurrent urinary infection, and at the same time she can spread the message to the other friends of her, the things she knows. She had today learned from my simple advice. These are very simple advices I have given, and so that then awareness is created regarding the incidence of urinary infection, why it is much more common in female, and what should a woman do if she had a urinary infection. This will spread a create an awareness among the female. For the male also it is important. I am not saying only female, but the male also can follow the same advice if they want, as because the procedure is same as what is done in female, but the incidence of urinary infection is common in female. So I have mentioned specially about the woman. So guys, follow me. I'll subsequently come in details what is urinary tract infection, why there is more common in female, what are the other things that a woman should do if she had a urinary tract infection, and how to prevent it, and what are the health benefit out of it. So just keep following my video, share it, so that an awareness is created, and we can try our best to sensitize the patient. As I have told today, I have spoken about the woman, about the urinary infection, because there are other differential diagnoses also at the same time. If she had this symptom, which can be ruled out subsequently once we rule out the urinary infection. So follow me and join me in my next video, where I'll give more in-depth ideas of urinary infection in female. Thank you all. Please subscribe my video. Thank you.